Good afternoon, everyone. Welcome to the Forum. It's our weekly program of the Columbus Metropolitan Club, where we cultivate conversations and connections that drive Columbus forward. The Forum brings together visionary leaders such as CEOs, members of Congress, UN ambassadors, college presidents, artists, and change makers, in order to examine issues that matter, exchange diverse perspectives, and forge connections that create a better Columbus. I'm Kristen Easterday. I'm the Director of Communications and Public Affairs at the Columbus Regional Airport Authority, and I'm also a proud board member of CMC. For those of you joining us by live stream, we're coming to you from the Ellis in Columbus's historic Italian Village. And thank you to our presenting sponsors of CMC's long-running Optimal Health series, including Nationwide Children's Hospital, Ohio Health, and the Ohio University Wexner Medical Center. Thank you to today's forum sponsor, Mary Haven, the presenting sponsor of our live stream, which is the Center for Human Kindness at the Columbus Foundation, and our live stream partner, the Columbus Dispatch. We are also grateful to the Ellis for hosting us. Every CMC forum takes a village, so let's thank everyone for supporting today's forum. So to our topic today. Welcome to Unraveling Recovery, How Cutting Medicaid Threatens Ohioans in Crisis. With key leaders and policy experts, we will unpack the consequences facing patients in recovery if the state's landmark care expansion is abandoned. We are honored to welcome today's panel. Oyama Garrison, the President and CEO of Mary Haven. Rochelle Martin, Executive Director of the National Alliance on Mental Illness of Franklin County. Amy Bush Stevens with Amy Bush Stevens Consulting, LLC, consultant to the Health Policy Institute of Ohio. And our host, returning once again to CMC, Greg Moody, Director of Professional Development at OSU's John Glenn College of Public Affairs. Greg, welcome back to CMC. The podium is yours.
Thank you, Kirsten, and thank you, panelists. I'm looking forward to our conversation about how Medicaid supports Ohioans in crisis, and specifically how the 2014 Medicaid expansion provides a lifeline for tens of thousands of Ohioans living with mental illness and in recovery from addiction. Just a decade ago, before Medicaid expansion, Ohio's healthcare system was in bad shape. More than 1.2 million people lacked affordable health insurance. Without coverage, many delayed care or ended up in the emergency room. Hospitals passed the cost of unpaid care to private insurance, raising costs for employers. Every rural hospital was at risk of closing, and some did. The opioid crisis was escalating, and county boards of mental health and addiction services were the only source of public funding for treatment. They couldn't keep up, and many residents ended up in jail instead of treatment. Right away, the expansion made a difference. More than 700,000 Ohioans, those earning up to 38% of the federal poverty level, gained access to health coverage, many for the first time. This led to the lowest uninsured rate ever recorded in the state. Medical debt was cut nearly in half. Nearly everyone in the expansion group was working, pursuing education, caring for a family member, or living with chronic physical or mental health conditions, often both. Consider this, before expansion, many frontline workers who were caring for Medicaid patients had no coverage themselves, but now they do. There's more. Health outcomes improved, primary care visits increased, more providers joined Medicaid to meet the demand, and expensive emergency room visits went down. 1 in 4 found out they had a chronic condition they didn't know about and got treatment. In the first 4 years of expansion, 630,000 Ohioans received treatment for mental illness or substance use disorders. Last year, 40% of the expansion group had a primary diagnosis tied to mental health or substance use and received more than $1 billion in critical services paid for by the federal government through expansion. Ohio's Medicaid expansion was a game changer for Ohioans in crisis, which is why it was an unexpected shock when Governor Mike DeWine included a kill switch provision in his proposed state budget that will automatically end the expansion if federal Medicaid funding is reduced. That means if federal matching funds drop by even $1, the kill switch will terminate the expansion and wipe out a decade of progress in mental health and addiction services. The Ohio House and Senate both approved the kill switch, but they have until June 30 to reconsider. One possible outcome is the federal government doesn't cut Medicaid, and the governor's kill switch doesn't go off, but that's a risky bet. There are two messages coming from Washington right now. Many of our elected leaders are saying they don't want to see cuts in Medicaid, including President Trump and Senators Marino and Husted. At the same time, the budget reconciliation bill currently under consideration in the United States Congress, Senate, includes some cuts to Medicaid, but not in areas that would trigger Ohio's kill switch and eliminate expansion. Regardless of what happens in Washington, if the Ohio legislature enacts the governor's kill switch, it will hang like a sword over Ohioans in crisis. So that's a lot to take in, which is why I'm glad we have this panel to help us sort it out, and I'm glad to get started. So please take a minute to reintroduce yourself. There are challenges working in this space, and you are each passionate about what you do. Where does that passion come from?
I'm happy to start. I'm Amy Bush-Stevens. I'm a consultant working with the Health Policy Institute of Ohio. And for me, this work is really about hope. I hope, and I think all of us hope, want to live in a world where help is available. I have personal experience helping someone in the aftermath of a mental health crisis. And we were so relieved and grateful that he had Medicaid coverage through expansion to help cover follow-up care, not to mention the costs of hospitalization. And I think, just imagine someone surviving a suicide attempt or surviving an overdose and then not having any help available after that, not to mention having medical debt to deal with. And that is just not okay, and so that is why I do this work.
Good afternoon. I am Rochelle Martin, Executive Director of NAMI Franklin County, the National Alliance on Mental Illness of Franklin County. I needed to let you know what that acronym stood for. So my passion comes from two women that stepped into my life when I came to NAMI Franklin County as the executive director. I thought I was all of that and a bag of chips. But these two NAMI mommies told me that I was there to help them change the behavior of people, help them with their behavior, living with a mental illness, and help families who are in crises of what to do. One of those women passed away recently. She was 95 years old. Her name was Ingrid Sylvian, and she was the co-founder of NAMI Franklin County. She had two daughters with severe mental illness, one of which has had over 55 hospitalizations. That's what makes me passionate.
First and foremost, let me just say thank you for joining us on this incredibly important conversation, because this is about saving lives. At the end of the day, we all value each other. We have this conversation about neighbors, but what does it really mean to be a neighbor? What does it really mean to care for someone other than yourself? And at the end of the day, that's what we're here for, is to advance each other and to ensure that there's some good that is done. And so I share that to say, because I get the honor and privilege, and I take that to heart, to get the honor and privilege of serving as the CEO for Mary Haven, which is Ohio's oldest and largest, most comprehensive behavioral health care provider when it comes to substance use disorder, mental health, and working with the homeless. Because see, only 20 years prior, there was another organization founded up in Akron, Ohio, called Alcoholics Anonymous. So since 1953, we have served over 400,000 people. And I say that and express it because when we talk about passion, and we talk about this work, and we talk about the impact that these Medicaid cuts could have, we're talking real human beings. These are lives. These are our neighbors. These are our family members. Folk that we don't even always talk about because maybe we didn't know. We didn't know they were battling mental illness. We didn't know that they were battling some substance use disorder. We didn't know. We didn't even know sometimes that they were homeless. So where does my passion come from? From being a young man born and raised in the city of Baltimore, Maryland, during the height of the crack epidemic with a father who served this great country, who got injured and was prescribed morphine. And when you come back home to a city like that, they don't just hand out morphine. But do you know what they hand out? Heroin, meth, all the other things. So my father, who served this great country, was a raging alcoholic, and he also was hooked on substances. And as a kid, I didn't fully understand it, and honestly didn't really build the connections until later in life because I sat in meetings with him as he went to those AA meetings and said the Lord's Prayer, which I actually knew before I knew anything else. So that's my passion, is to help make a difference, to help ensure that someone who wakes up today wrestling with an issue can find a resource to help change their lives and get it back on track.
Thank you. So it's kind of hard to believe the expansion's only 10 years old. For each of you, what results have you seen from the Medicaid expansion? And let's do this in two parts. Let's start first. What's the broad impact on communities across Ohio from expansion? And Amy, I'll go back to you first.
So Greg, as you mentioned, our uninsured rate was cut in half in Ohio. It went from 14% to 7%. And the expansion has brought in significant federal resources for mental health and substance use disorder services in Ohio. So just in 2024, just for the expansion population, it was over $1 billion for these services in our communities. So this is things like outpatient counseling, case management, residential drug treatment, and also behavioral health related hospital services. That over $1 billion amount doesn't even include medication. So if we were able to add the pharmacy spending into that, it would be even more. So significant resources. And what that's allowed our communities to do, our ADAM boards, for example, that has freed up resources for them to invest in things like prevention and recovery supports, crisis response. Our ADAM boards are the alcohol, drug, and mental health boards. So here in Franklin County, we have the Franklin County ADAM board. They're represented here today. And we have 50 of these boards across the state covering all of our local communities. And they have really been able to, because of Medicaid expansion, prior to 2014, a lot of their spending was on treatment. After expansion, they were really able to focus on other priorities and community partnerships with housing and criminal justice. So we've really seen investments in things like permanent supportive housing, recovery housing, which is very important, a more robust crisis response, like the crisis care facility that's opening this summer in Columbus, which is very exciting. and things like reentry programs for people leaving jails and prison, and drug courts. You know, in drug court, you get ordered to treatment. Medicaid is often the coverage for that treatment. So many, many investments in very important things that supplement treatment.
Okay. So focusing in on individuals and families, how has the Medicaid expansion impacted Ohioans who are living with mental illness or in recovery? And Rochelle, I'll go to you first.
So, people are now getting care, therapy services, outpatient services, job-related issues, counseling, not being homeless, being able to survive with their families, family stability for a change, families not worrying about their loved ones pitching a tent in their backyard and living there because they don't have the care that they need. Healthcare outcomes are better. Just being able to survive and help families to survive. I receive calls all times of the night wanting to know, where can my family member go and what is going on with them. So being able to refer them to our providers that I have befriended to get them into care is outstanding. And I'm happy to report that people do get care right this moment. I had a gentleman to come to my house yesterday to work on my house. And he asked me, he said, "What do you do for a living?" And I told him. And he said, "I need your help. My fiance is in a hospital for mental health care. And I don't know what to do about this." And I said, "Call me, because NAMI can help you."
So I am grateful for the statewide campaign around Beat the Stigma. I am grateful for all the information and awareness that we are bringing to not only mental health, but substance use disorder treatment. And I'm grateful for all of this because it is having a positive impact on the community, but it's also helping families have real conversations, right? So I come from a family where we would have probably never talked about any of this, even if it did exist. Some people know this as a reality in your own home. Chances are, as a kid coming up, you were probably dismissed. Somebody was staying in a separate room. Whatever the journey was, chances are you just weren't educated about it because we didn't want to talk about it. And in fact, we thought if we don't talk about it, it won't happen or it doesn't exist. Well, that's false. The reality is today we talk about 6 degrees of separation and we think that it truly is 6. No, it's no longer. When we think about substance use disorder and mental health in many families today, it is less than 2. Because chances are someone is wrestling with something. And we saw it even as a result of the pandemic that we all experienced in 2020. At Maryhaven, we saw alcoholism with women quadruple coming in. Dual diagnosis, mental health, and substance use. Since the state of Ohio has allowed online sports gambling and betting, we have seen the volume quadruple from young men who are saying, I have a problem. Because when we think about mental health and we think about addiction, we often think alcohol, opioids, and so forth, but the reality is it's more complex and more involved than that. So you should also be grateful to know that in your community, in your backyard, we have, from an impact perspective, one of the only diversion programs in the Midwest that allows individuals who are intoxicated to have a place to go instead of going to jail. And they come to us at our engagement center over at Maryhaven. No, they're not all homeless. No, they're not all destitute. No, they don't all have a criminal background. And that's the other stigma we have to break. The vast majority of the people we see look just like you. The vast majority of the people that we treat are your family members, your coworkers, and your friends. And so I want to go back because you asked a question about community impact. We did the homework. We did the math. And since 1953, Maryhaven has had over a $1 billion economic impact on this state. We've helped people get their lives back on track, open up businesses, get going again, and be contributing members of society.
So the positives of expansion, if the kill switch that's currently in Governor DeWine's budget is triggered, what are the consequences of losing expansion? And as one of the largest providers in the state, maybe, Oyama, why don't you take that?
You know, as I mentioned a little bit earlier about that impact, about those 400,000 people, so here's the reality. Since then, providers like us, but in particular, I will speak on behalf of Maryhaven, we've served 78 of Ohio's 88 counties. We have clients that come in from pretty much all over the state for detoxification, and in particular for alcohol detox, which is the most deadly detox that you can do. Medicaid helps us with that. More people have access. But here's what I want you to understand. If that kill switch were to go in, if we saw the benefits of Medicaid actually erode, it is going to be rural America that is going to be devastated the most. And you're asking me how and why. Because the healthcare systems in most of the rural counties throughout our great state depend on those individuals who may or may not be working, could have a disability, whatever the case may be, but they have Medicaid benefits available to them because of the expansion efforts. And when they're healthy, they can work. But when they're unhealthy, they cannot. And we've already had conversations with many individuals out in these communities and healthcare providers who have said they're going to have to shut their doors because the vast majority of the clients they see don't have private pay insurance. They have Medicaid, something that they work for and also contribute to as a taxpaying citizen that we're going to likely take away from them. And those providers will not be able to keep them healthy in their own communities. So how do we know? Because we talk to them, and we listen, and we advocate for them. Because at the end of the day, one life saved is well worth it.
And then you're talking about people not being able to get their medication. So their medication will be gone. Homelessness, you think homelessness is bad now? Just wait. All of the services, the therapy services will be gone. The case management services will be gone. I went through our Adam Board directory and looked at all of the services that we provide in our system. And we could lose over 55 programs because of the expansion being cut. This is a critical problem, folks, that we are up against. And we, as citizens, have to do something to help our communities, to help the people that we serve. Some of them are your neighbors. Some of them are your family members, as Oyama has said. We need Medicaid expansion.
Zoom out a little bit and get a little bit wonky with some of the numbers behind this, the number of our neighbors who could be affected. So the Urban Institute recently did analysis for Health Policy Institute of Ohio, and you can find all of this material on their website. But they did an analysis to see how many people who are currently covered by expansion, what would happen to them. The biggest group would become uninsured. The next biggest group, a smaller group of folks, would potentially be able to get coverage through their employer or through the health insurance marketplace. But there are serious limitations with that. So with the marketplace, folks who have incomes below the federal poverty line are not eligible for subsidies in the marketplace. And then when we think about getting coverage through an employer, there are a lot of affordability concerns. And so, there's premiums, co-pays, deductibles that folks don't have in Medicaid. So if you're, imagine a home health aide making $16 an hour, trying to pay rent, the thought of having a premium taken out of your paycheck every week, the math just doesn't always work on that. And a lot of people are being offered high deductible plans. They might have to hit a deductible of $5,000. And that would just be very difficult for folks to afford care in that situation. So the upshot of all of this is that we would have far more folks in our state who are uninsured or underinsured. And what that would mean for our ATOM boards in our local communities is that, and we did a survey of the ATOM boards, and they told us they would need to increase spending on treatment to cover those folks, and then decrease spending on prevention, family supports, recovery supports, and things like that. They also told us that they predicted, many of the things that you talked about, increased, people being in jail, being homeless, having crises, being hospitalized, going to the emergency room, and things like that.
Yeah, one interesting detail, Oyama, picking up on something you said with rural hospitals. It's kind of this interesting detail that right now the key protection of the expansion is coming from federal conservative legislators. And when you look at those 32 critical access rural hospitals, they're represented by 42 elected districts, one of which is a Democrat and 41 of which are Republicans. So I think it's being recognized and interpreted as kind of a core to the base kind of issue at the federal level, even as it's not being acknowledged at the state level. So Medicaid is complicated. Not many realize it's the primary source of funding for behavioral health treatment capacity in the state. What's something about the Medicaid program that you wish everybody knew, but maybe they don't?
So I'll start by saying, since its conception and going live, most people probably have no idea that as the institutes were tracking data associated with those who are uninsured or underinsured, and those who have some level of access, self-pay, whatever the case may be, 1 in 5 lives have been saved since its enactment. That's 1 in 5 lives. So when you think about it, from the point that they enrolled and were eligible, that first year, the program was already saving tens of thousands, if not hundreds of thousands of people's life by providing access. And I think that's important for us to understand. When individuals are healthy, I can't say this enough, when they are healthy, they are capable of working and doing other great things in our community. But when they are not, what happens? We all can probably think of a kid, or maybe it was us at one point, that woke up, went to school, and didn't have any breakfast or anything along those lines, and maybe you had a test that day. It kind of fogs your memory a little bit when you start getting hungry. You may not always be able to think clearly. Now imagine if you're wrestling with some chronic disease. Chances are you're not going to be able to function well if you don't have access. If the hospital in your community just closed, if the providers in your community packed up and went elsewhere, if you don't have benefits to be able to help you get the treatment that you need. That's real.
So, the issue that I would like to talk about is the fact that people who are living with a mental illness, their medication is going to go away. They need their medication in order to function, some of them. And so understanding that if your family member doesn't have the medication and they're doing things that are not appropriate, what does that do to the family's stability? Because the family member gets out of sort because I don't know what my loved one is doing, and they don't have the access to their medication. That is real. When they lose their Medicaid, they could be homeless, not having a place to live. That's real.
Yeah, along those lines, Medicaid coverage is particularly important for those who have serious mental illness. And we see from research that among folks with serious mental illness, they're actually more likely to get treatment if they have Medicaid, even compared to folks with private insurance, and certainly compared to folks who are uninsured. And Medicaid really covers a comprehensive range of services, including things like case management, that is really important, and peer support, which we've really invested in this state. And private insurance often doesn't cover those things.
And I want to give you an example of someone who is receiving shots for their severe mental illness, for their schizophrenia. Those shots are extremely expensive. But the fact of the matter is, when Medicaid goes away, they're not going to be able to afford those injections. It's just a bad situation for people living with a mental illness and their families.
Thank you. So apart from Medicaid, on purpose, we've really focused on the intersection of the capacity that comes through the expansion in these services. But apart from Medicaid, you have an incredibly well-connected and thoughtful audience here. What do you want them to know about behavioral health services in Central Ohio? And maybe for someone who wants to learn more or help out, what do you recommend?
We have some of the best providers in the country here in Franklin County. And we have partnerships among us. We can go to each other to get people connected and to talk about what's going on with a family member or with a loved one, with each other. Just think, we could lose half of them, including NAMI Franklin County. So we have a relationship that is great and purposeful with helping people to thrive.
So I echo everything that Rachel said. You should be proud. I mean, the reality is we have some really amazing providers that are providing services here in Central Ohio. I'd say that we also have some awesome providers in our rural markets, but they don't always have the same level of resources available to them. When we talk about the continuum of care and helping someone navigate and move through this process so that we hopefully will never see them again, when it comes to substance use disorder treatment and or mental health, and in some capacity, even homelessness, we have our Adam H. Board. We have CSB. We have a city council. We have commissioners. We have people who actually give a damn. And I think that's important for you to know, because we work collectively as providers and partners to ensure success. Why? Because we want every single person that walks through any door of any provider, hospital, you name it, to be treated with dignity and respect like anyone else, and receive a level of care that allows them to just live a good life. And I want to frame it for you, because even as we think about this, we all have to understand, most of us that have probably gone through some sort of college experience, chances are you heard the story of someone who had a beverage or tried something for the first time. And guess what? Their lives were changed. They weren't bad people. They weren't out here robbing and stealing. They were just like you and I. And an unfortunate scenario changed their life. That happens more often than not. And the great thing about us here in Columbus and in Central Ohio is we have passionate, dedicated people who wake up every day to give back. Those are our frontline workers, because they are passionate about the work. They've gone into social work. They've gone into the field and study of psychology and psychiatry. They've gone in to understand how to help people navigate through all of these challenges that they may face. And let me just share with you, if you ever think that for one moment you might not experience homelessness, I sure hope you're sitting on one incredible endowment of trust, because I know people. They were the working homeless, living out of their cars. All kinds of dynamics that play out. But the challenge again is, when people are under stress, and in the work that we do, what ends up happening? A good portion of them turn to things. And for some that may be alcohol, for some that may be gambling, for some that may be gaming. Yes, online addiction to gaming. We treat that at Maryhaven. Whatever it may be, it could change their life. It can change their families' lives. We've talked with people and treated people in rural America, you heard me say that right, with kids under the age of 5 battling substance use disorder and mental health.
The only thing I would add to that, thinking specifically about Central Ohio, is just to mention the Franklin County Crisis Care Center again, and just to note that the Adam Board estimates that about 80% of the folks who will go to the center will be eligible for Medicaid. So as we think about the success of that center going forward, Medicaid is a key piece of that equation.
Well, panelists, thank you. Now we're going to shift gears. It's CMC's longstanding tradition to take audience questions. We'll move to questions from our live stream and in-person audience right now. If you have a question, please make your way to the microphone now, there where Doug is. And if you're joining us on YouTube, please type your questions into the chat. Doug.
Greg, thank you so much, and thank you so much for today's panelists for a very powerful conversation at CMC. Thank you all. Please do join us here at the microphone. If you have a question, we'll try to get to as many as we can. Great questions at CMC always have two things in common. They can be asked in just a sentence or two. And what punctuation mark does a question end with? It ends with a question mark. Thank you very much. I'm going to launch us off with this one. Very briefly, just to reiterate, because this is so important, can you walk us through how the kill switch actually would work, and why was it included in the state budget in the first place?
If panelists don't mind, I may take that one. So the way it works, there's a provision in the budget that's very simple. It's a couple sentences. It says if the federal matching participation, which is currently at 90% federal, which means it's 10% state, if that number drops, it automatically eliminates Ohio's expansion. It's that simple. So imagine if that matching rate, because the federal government needs to save some money, goes from 90% to 89%, it would eliminate Ohio's expansion, even though 89% investment in our state is still a really good deal. So I think the point with it is it's a switch. It's yes or no. It doesn't allow for any debate within the state around whether something is still worth it or maybe something that we need to move on from. The how it got in, the Governor's Office of Budget and Management included it in the governor's budget as introduced into the House. So the provision was generated by the governor.
Thank you for this essential panel and the life-saving work that all of you do. My name is Mike Hochran with Mid-Ohio Food Collective. We've talked a bit about the bills moving through Congress and the State House and the devastating cuts that would come to Medicaid. But what we haven't talked about is how Congress is also preparing to make the largest cuts to federal nutrition programs in America's history. So hunger is on the march in Ohio. We're already seeing record need for food, and that's before these cuts to Medicaid or SNAP go into effect. How would the loss of such a basic need, and nothing's more basic than food, how would that impact health and recovery for the vulnerable people that you all serve and speak for?
Well, they'll be hungry. They won't have a place to go to get their food. That's terrible. That's outrageous to think that people will be homeless and hungry.
I hate to say this, but what we also know in having conversations with clients is typically speaking, if people are going to experience significant levels of hunger, they try to figure out ways to dull the pain. And if they're going to try to dull the pain, guess what they're going to turn to in their communities? 2020, 2021, 2022, alcohol sales in this state went up 20% year over year. So if you can imagine, if communities are starving, they're going to turn to the very substances thinking that it is going to cure their pain, that is going to likely lead to greater levels of death in our community.
My name is Brian Urbanski with the Aubrey Affordable Housing Foundation, and we provide deeply affordable housing to folks in recovery and other vulnerable populations. And Oyama, it's great to see you, and I'm very proud to say that we already support Mary Haven by working with Teresa Hall and Angela Goodman. And where our concern is with the cuts, if these Medicaid cuts are enacted, how will this impact your ability to provide supportive and affordable housing to the folks that you're serving?
So we have, as I mentioned earlier, Mid-Ohio's best and candidly only diversion program for those who are experiencing some level of homelessness and intoxication. Right now, with our permanent supportive housing unit, we actually have a 45% success rate. So that means as they're coming in from our peace officers all around this county, we have an opportunity to work with them to get them detoxed, and also talk with them about getting housing. But it's been challenging. So we've gone from a wait period of relatively about 30 days of being able to get someone into housing to now well over 120 plus days. That's still if we can find them a unit. So this is just going to compound a scenario that will just be a perpetual cycle for people who are trying to break the cycle. So we have to think as human beings, how good are we to each other? And this is another avenue that we know will lead to further deterioration. Thank you.
And I'll add to that, that right now we're in a situation where it's actually easier to get health care than it is to get housing. But for recovery, you need both. They're both really important. And so if we lose Medicaid expansion, we're going to be looking at wait lists for mental health care that are like the wait lists that we have for housing, which we know are way too long.
Hello, my name's Jeffrey Lemichuk with CareSource. And so we've talked about the possibility of state or government cuts to Medicaid, but we also need to address there's a staffing shortage and need in behavioral health. So if all these events were to occur and a perfect storm were to happen, would AI technology be able to pull us out of this and solve the behavioral health need, or do we still need the human touch involved with BH?
We need the human touch. You know, that's what people need. We got to be able to connect with each other. AI? Come on. No. That's not going to work.
I think there's going to be a place and space for everything. But the reality is if you go into the emergency department with a broken arm or a gashing wound, AI isn't going to be able to help you with that. You need a person. You need an individual. Well, the same thing applies to individuals battling severe levels of mental health and substance use. AI can't help you navigate through that. It can certainly help maybe on the other end of the treatment spectrum, but during that initial phase, you need good quality people. And when you talked about staffing shortage, I think we're all seeing it and we're all facing it and we're all wrestling with it because there's some good people who have done some good work, but they've been burned out. We know people who don't mind working on the front lines, but there's a shortage of individuals who want to actually get into behavioral health care in the first place. And we're trying to do our best, and there are some tools and resources from the state to help educate people relative to that. But at the end of the day, nothing can replace that human touch and interaction and the ability to detect the needs of other human beings.
And then in addition to that is that when the programs begin to be cut, so we have to lay off staff that are providing those services. So those programs will be ending.
Hi, my name's Erin Hart. I'm with the Ohio Healthcare Association. You guys have talked a lot about the potential threat to Medicaid expansion that's not currently in the reconciliation bill of the federal government. My question for Ms. Stevens and Mr. Moody, I almost called you director, sorry, is this. Have you done any research into the impact into the existing cuts to the Medicaid budget for Ohio, specifically on the hospital provider tax and the managed care tax that will reduce our federal Medicaid funding by $6 billion, and what that might do to supportive care and services for behavioral health?
I haven't done any research on that, and I don't think HPIO has put anything out specifically on that. Do you have any?
Yeah, and what this issue is, I mentioned that there are cuts contemplated in federal legislation that are not the kind that would eliminate the expansion. So it's not related to cuts in the federal match, but there are some financing mechanisms that are being targeted. For example, hospitals put up money that's used to draw federal money, and there's a federal view that there's concern with that. So the bill currently being contemplated is looking at reorganizing, grandfathering, limiting mechanisms like that, but it's not resolved finally yet in the federal legislation.
Yeah, good afternoon. My name's Ann Sarah, and I have a son on Medicaid. And I have sort of a two-part question. I wonder how many people in Ohio would be affected directly by a cut in Medicaid? And secondly, how is that 10% connected to the big, beautiful budget nationally?
So in terms of the number of Ohioans who have expansion coverage, it's 770,000, and they live in all areas of our state. As for the question about the big beautiful bill, there are, in the House version, there were several changes that would increase the administrative burden of the Medicaid program, so make it harder for people to kind of get through the paperwork hurdles and to stay enrolled.
Thank you. We have just about 3 more minutes for a final question.
Hi, everyone. My name is Will Petrick. I'm with Rise Together Innovation Institute. Thank you so much for the information today. My question is, I think everyone in this room wants people to have the health care that they need to thrive and to just, again, participate in the community and the economy. I know Governor DeWine's budget included the kill switch. It was included in the House. The Senate proposal came out yesterday. My understanding is that 770,000 people across the state who could just be pushed off of Medicaid. Here in Franklin County, I think 115,000 people. So the question to you is, if you're advising all of us in this room and we want to protect healthcare coverage for our neighbors and the people that we love, what can we do? What should we do? What's our message together in this room as we're talking to state leaders now through the end of June?
I'm happy to take that first, and then if you also want to jump in. I think one thing you can do is go to the Health Policy Institute of Ohio's website to learn more. There's information about Medicaid basics. There's county level data that you can use in your advocacy. The HPIO crowd is over there, and they actually have hard copies of some things. So if you feel like you need to learn more about this issue, that's a great place to look. Then I think, advocacy is important. We, at both the state level and the federal level, we are in the final phase of the state budget process. So make sure you know who your representatives are in the Ohio House and Senate. Let them know how you feel about this issue. Let the governor know how you feel about this issue, because he does have veto power. And then at the federal level, it's the Senate now that is looking at this. So reach out to our U.S. senators and let them know you are a constituent. Let them know your personal experience and why this is important.
Get involved and volunteer. Come volunteer for NAMI Franklin County. And go to, as Amy has said, go to your legislators. NAMI has done that, and we will continue to do that, to let them know how we feel about this and what's going to happen to our families and our loved ones living in this community.
First, let me just start by saying, I know this is a heavy topic. Nobody wants to talk about substance use disorder, mental health, and homelessness, but we have to. People are out there counting on us. And I know it's heavy in some respects, but it's advocacy, advocacy, advocacy. You've got to get out there. You got to talk to your elected officials. You've got to share the stories and make it real and human. Because oftentimes we may just be looking at, or they may be just looking at numbers. Make it real. Because I can tell you the conversations we're having with the constituents and the clients that we work with in rural America, they're making it real. Because they're sharing their stories. They're placing those phone calls. They're writing those letters. I know writing, probably email, who knows, right? But they're doing it. They're communicating. They're helping to make it real. I can guarantee you, you know somebody. And if you don't, chances are, could be you. But there's a lot of people. There's a lot of people on Medicaid that you just may not know who are benefiting from it, and let's continue to advocate for them.
One thing I'd encourage you to consider too is the expansion and mental health and addiction treatment services are sometimes viewed as two things. I have concerns about the expansion, but you will find a lot of political support in the legislature for mental health and addiction treatment services. Make sure folks understand it's the same thing. Make sure you contact your House and Senate Ohio leaders and let them know we can argue about policy, but this kill switch came in without discussion. It can go out the same way. This is a classic thing that can disappear at 11:59 on June 30 when the budget's being completed. So make sure folks understand that you have an interest in that. Okay, I always wish we had more time. So I'm going to hand it back over to Kirsten.
Well, I hope everyone found today's community conversation both urgent, but as Amy said from the beginning, hopeful. So I would like to thank you, the presenting sponsors for CMC's Optimal Health Series, Nationwide Children's Hospital, Ohio Health, and the Ohio State University Wexner Medical Center. And thank you to today's forum sponsor, Mary Haven, our live stream sponsor, the Center for Human Kindness at the Columbus Foundation, and our live stream partner, the Columbus Dispatch. Thank you to the Ellis for hosting us, and our very special appreciation for today's speakers, Oyama Garrison, Rochelle Martin, Amy Bush-Stevens, and our host, Greg Moody. We would love it if you would make plans to join us next Wednesday, again, right here at the Ellis, for High Tech Careers means high stake education. And that will feature Pat Teaberry and a terrific panel. So thank you, everyone. We couldn't do this without you. Have a great day.